Virus pandemic, many doctors' offices are closed right now for wellness checks, and that includes your dentist. So what happens if you have an emergency that is not coronavirus related? Well, joining us live tonight is Dr. Andrew Rosenstein of Connecticut Pediatric Dentistry. Doctor, thank you very much for joining us here at 5:30.
Hi, thanks for having me.
Well, let me ask you first, how are offices like yours, how are dentists really adapting right now during this situation?
Well, we're not completely, incapacitated or dead in the water. We are available for emergency phone calls. Obviously, our services are reduced to emergency calls only, and all routine and non-emergent care are being deferred at this point.
Is there anything you can do, doctor, as a dentist that helps local hospitals or other doctors really right now fighting the pandemic?
I think that, creating this equilibrium where we try to do as much as we can without spreading the virus, as well as keeping patients out of the emergency room, is probably the biggest thing right now, because they have their hands full, and our job is to try to keep as many patients of ours out of the hospital as possible. So we are seeing emergency patients in our office, all depending on exactly what's happening. So everyone's case is different. So we let people call us, and we decide what's worth going in for and what's worth going to the hospital for.
I was actually just going to ask you that. Obviously, you will take a patient if there's an emergency. I would imagine, a cavity is one thing, but if a tooth falls out or you have a major infection in your mouth, that may require treatment.
Of course. So the American Dental Association has given us many guidelines to follow. If the emergency is not a severe trauma involving severe pain, swelling, or infection, if it's something cosmetic or something where it's just sensitivity, something more on the lighter side, it's something that can be deferred because it's not worth spreading the virus. But if there is something that's, causing severe pain, or something that's, severe injury to the head or face, it's something we have to look into and address before we send them to the hospital. So we are available for calls, and we go from there.
Obviously, you've never seen anything like this, I would imagine. Who has at this point? How is your staff dealing with this, and other people in your profession? I know hygienists are laid off right now. This is just impacting everyone everywhere.
Oh, it's unbelievable. I think that how it's affecting our staff is one of the craziest things right now, because there's nothing we can do. I mean, we're dead in the water in that aspect. And as far as the partners in my practice go, we're all on call. All of us are in this game together. And depending on what happens, obviously we would bring in an assistant if need be. Hopefully that doesn't happen. But as of right now, the whole staff, hygienist, anyone involved in routine or non-emergent care is unable to perform their duties at this point, unfortunately.
Okay. Well, doctor, we appreciate you joining us this afternoon. Thank you very much, and good luck to you and to your whole staff throughout the rest of this situation that we're all dealing with right now.
Thank you. Stay safe.
Thank you.